There are also a whole host of very rare side effects that happen less than 1% of the time, but when you start treating hundreds of lung cancer patients, when it becomes the standard of care for everyone, you're going to see that because it's such a common disease. You can see pancreatitis, you can see inflammatory arthritis and polymyositis, you can see ocular complications and hematologic toxicities, and essentially you just need to have a high degree of suspicion. So if you see something weird that's happening, always assume it could be related to the drug that you're working on. So the special things to keep in mind, the first I would say is hypothyroidism. So it's much more common than what's described in the literature in my clinical experience. I would say maybe even a quarter of patients can have that. But you only find it if you look for it. So you need to check the TSH at baseline. Probably should check it every few months whenever you do an assessment of the patient's tumor. And what you'll often find is actually they start with hyperthyroidism with a very low TSH, almost always asymptomatic, and then eventually they proceed to hypothyroidism, which is irreversible. You don't have to stop the drug, you just replace the thyroid hormone. You don't need an endocrinologist to treat this, but you do need to work it into your standard practice to check and monitor TSH. The other major side effect that I think people need to be aware of is pneumonitis. So pneumonitis can happen in up to 5% of people with lung cancer who get these drugs. Very serious pneumonitis probably only happens 1 to 2% of the time, but it can be, when people die from these drugs, that's one of the most common reasons that happens. And it usually presents with shortness of breath and cough. If you have a patient who gets that with lung cancer, there's lots of different reasons for it. I strongly recommend doing a CT scan of the chest as soon as they develop these symptoms to differentiate an infection from potentially pneumonitis or PE or some other cause. If you have any inflammatory changes, you need to hold the drug. If it's just radiographic, you can just observe it, hold the drug, and retreat when they resolve. But if they have symptoms related to this, then you really need to treat with steroids early.